Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about measles. Measles, also known as rubeola, is a highly contagious viral disease. In fact, it is so contagious that 9 out of 10 susceptible individuals will become infected if they are near someone with measles. Measles became notifiable in the United States in 1912, and there were an average of 6,000 deaths each year in that first decade. During the decade before the vaccine became available, each year there were about 3 to 4 million infections, about 400 to 500 deaths, about 48,000 hospitalizations, and about 1,000 encephalitis cases related to the measles. The vaccine became available in 1963, and there has been more than a 99% reduction in cases since then. Measles was declared eliminated in the United States in 2000, but we have had outbreaks since then. There have been as few as 37 cases in 2004 and up to 667 cases in 2014. There are still millions of cases worldwide each year, and measles is brought into the United States through travel. According to the CDC, measles is the most deadly of all childhood rash or fever illnesses. Measles is spread through respiratory droplets from the nose, mouth, and throat through sneezing, coughing, talking, and sharing drinks or utensils. It can also stay in the air or on surfaces for up to 2 hours, so you can get the measles even if you are not physically exposed to someone who is infected. The incubation period for measles is about 10 to 14 days. Initial symptoms include a high fever up to 104 degrees Fahrenheit, cough, runny nose, red eyes, light sensitivity, muscle aches, fatigue, and tiny spots with blue-white centers inside the mouth known as Koplik spots. About 3 to 5 days later, a rash develops. It starts on the face, then spreads downward. A person is contagious from about 4 days before the rash to about 4 days after the rash starts. Diagnosing measles may be done through a physical examination, blood tests, nasopharyngeal swabs, or urine samples. Be sure to tell the staff on the phone that you may have measles so that they may take precautions to reduce the risk of exposing others. There is no specific treatment for measles, but there are things that you can do to help ease the symptoms. Be sure to drink plenty of fluids and get plenty of rest. Have dim lighting for light sensitivity. You may use a humidifier to help sore throat and cough, and you may use non-aspirin fever medicine. Aspirin can cause a rare but serious condition called Ray's syndrome. More extensive treatment may be done if you develop complications such as antibiotics or hospitalization. Anyone who has not had 2 doses of vaccine or already had the disease are at risk for measles, but some are at greater risk for complications. This includes those with a vitamin A insufficiency, those who are immunocompromised due to certain medications or medical conditions, children younger than 5, adults older than 20, and pregnant women. Severe measles complications include blindness, ear infection, which may lead to deafness, encephalitis, which occurs in about 1 in every 1,000 children with measles, brain damage, severe diarrhea or dehydration, pneumonia in up to 1 in 20 children with measles. This is the most common cause of measles death in young children. Seizures, bronchitis, pregnancy complications such as preterm labor, low birth weight, miscarriage, and maternal death, hospitalization in about 1 in 4 cases, and death. You should see a doctor if you are exposed to measles and susceptible, especially if you are in a high-risk group for complications, if you develop an unexplained rash, or if you develop severe symptoms. Vaccination is the best method to prevent measles. The vaccine is about 93% effective after 1 dose and about 97% effective after 2 doses. The recommended ages to receive the vaccines are dose 1 at 12 to 15 months of age and dose 2 at 4 to 6 years. Vaccines may be received earlier in the case of international travel or outbreaks. You can also catch up doses later for older children or adults. Be sure to talk to your doctor to find out if you need vaccinated. Indiana requires 2 doses of vaccine or proof of immunity for those in kindergarten through 12th grade. Many colleges require it as well. There are 2 vaccines available: the MMR vaccine, which is measles, mumps, and rubella, and Proquad, or MMRV. This is measles, mumps, rubella, and varicella. There is no vaccine only for measles. Vaccine may also be given to unvaccinated people within 3 days of exposure or immune globulin within 6 days of exposure to prevent disease or to lessen the symptoms. Some people are unable to be vaccinated due to their age or medical condition, so those around them should be vaccinated. Despite some beliefs, there is no evidence to support the idea that the vaccine is linked to autism. Be sure to avoid others if you are infected, especially if they have never had measles or the vaccine, or if they are in a high complication risk category. Stay home from school, daycare, and work until 4 days after the rash develops. Wear a mask if you must be around anyone. If you have not had the vaccine due to medical or religious exemption, and there is a case of measles at your school, preschool, or daycare, you must remain home until 21 days after the last time you were exposed to an infected person. You may return to work or school after the receipt of the vaccine if you are able to receive it. This concludes the measles presentation. If you have any questions, visit any of these websites, contact your doctor, or contact your local health department. Thank you.